This is One-on-One. We're speaking with Dr. Nancy Chiaravalloti of Kessler Foundation, also research professor, Rutgers, New Jersey Medical School. Doctor, let me ask you this. The cognitive issues, the memory issues as it relates to MS, talk about them.
Cognitive problems are very common in people who have multiple sclerosis. What I mean when I use the term cognitive problems is your ability to think clearly, to process information quickly, and to remember things. And if you think about your everyday life, we use our cognition constantly. We're always trying to remember new names, learn new faces. We're trying to follow along in conversations, drive, pay attention to different things at the same time. Those are all things that entail cognition, and they can be very difficult for someone who has multiple sclerosis.
So someone, it does not, let's just say this, someone doesn't have MS. They're living a certain kind of life, and all of a sudden they're diagnosed. Are there certain memory cognition issues that usually happen pretty quickly, and what are they?
MS is a progressive illness, so what happens is the disease progresses over time and it gets worse and worse. So as the disease progresses, these cognitive problems tend to begin to appear and then get worse as time goes on. So they won't get diagnosed on Tuesday and have a memory problem on Friday. What will happen is they'll get diagnosed on Tuesday and they may start to see that they're having some trouble paying attention. So as an example, when they're watching a movie, they may have trouble catching on to all the little details and following along in the plot. And then that may get worse as time goes on as the disease progresses. And then they may begin to have trouble remembering things. So when they meet a colleague and they see a new face and attach a name to that face, they may have trouble remembering that name over time.
So folks listening to you right now, doctor, might say, well, that sounds like a form of Alzheimer's, but it's not?
It's not. The pathology in the brain is different. So what
Define pathology.
Pathology is the disease process that's actually happening at the level of the brain is very different. What that means is that the symptoms and the way the symptoms appear, the order in which they appear, the speed in which they appear, are different. So someone with MS, if you think about MS is diagnosed very young. So you're talking about someone who's somewhere between the ages of 30 and 55 being diagnosed with MS. Think of what we're doing between 30 and 55. We're working, we're in the prime of our lives, we're raising children, we have very complicated schedules, and to then have a neurological illness that you know is progressive thrown upon you and have to deal with that, that's very, very difficult. So as your cognition gets worse, you feel that in your everyday life because you're demanding a lot out of yourself. Now, what's different in a disease like Alzheimer's disease, the population tends to be older and the demands of their life are somewhat different. So they may not be working anymore. If they are working, they tend to have a little bit of a lighter schedule, a little bit more flexibility than someone who's 30 years old and raising their children and juggling a work schedule.
So I want to talk about treatment in just a second, but I'm curious because one of the things we're doing tonight here at Kessler Foundation, there's a forum, an MS research forum. We're talking to a whole range of people, and one of the people we're talking to, a registered nurse by profession, approximately a little less than 40 years ago was diagnosed with MS, participating in MS research here at Kessler Foundation. How challenging is it to get people to participate in these studies, which are absolutely critical to finding what you need to find out, right?
Absolutely. Without the patients volunteering to participate in our research, we couldn't do our research. We couldn't develop the treatments that we're developing, and we couldn't show the data that indicates that these treatments are actually working and they're actually helping people. So people volunteering to participate is absolutely crucial. We advertise all the time. We have advertisements on our website at support groups. We advertise through physicians. It can be difficult to get people to volunteer just because they don't know exactly what's involved. But I would encourage people to give us a call and to talk to a research assistant, one of our staff members, who can tell them exactly what's involved so they know. We don't use any medications unless they want to do that type of research. We don't inject anything. It's really the work that we do is really trying new treatments and testing the effects, and those treatments are not treatments that are invasive in any way, shape, or form.
You know, it's interesting. I've actually worked with Dr. Chiaravalloti and some of our colleagues in in some leadership and communication seminars, and one of the things that I've been challenged by, and I want you to talk about this, are the communication issues, frankly. And sometimes I wonder how hard it is to communicate, frankly, very complicated, clinical, technical issues to those of us who are not trained in the way you are. Am I making too much of that?
No, what you're saying makes perfect sense. It's a very complicated picture, but it's very understandable to someone who puts the effort in to try to understand it. So thinking about, I want you to think about your everyday life and what goes into your everyday life. So you wake up in the morning and you have to get dressed, and you have to get dressed in a certain sequence in order to successfully get dressed. You're grabbing your keys, you're running out the door, you might have kids that you need to drop off at school. That's a lot of what we call executive functioning. So it's sequencing your actions. It's deciding what you do at what step. And that takes a tremendous amount of cognitive abilities. It takes processing speed. It takes organization. It takes memory. So where do you have to drop Jack off versus Sue? And what time does Jack have to be there? What time does Sue have to be there? And then what time is your meeting? Where do you have to go next?
And someone with MS, for those of us who take that for granted right now, someone with MS,
it's very, very difficult for them to keep track of all that, to remember any new information, any changes, which, as you know, happen all the time, and then to carry everything out successfully. It's very, very challenging. However, it can be done, and we're developing treatments to try to help them to do these things better.
finally, Doctor, you sound hopeful about the research as well as the treatments.
I am hopeful. I'm hopeful because we're making some real progress. We are developing new treatments, and we have patients who are volunteering to help us out and learn more about these treatments and show what is working and what's not working. And then we're also doing research where we're actually looking at how the brain is changing, and that's showing us why these things are working. The reason that's important is because if we know why something's working, then we can refine it, we can make it better, and we can develop more treatments that do the same thing.
Thank you, Doctor.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Russell Berry Foundation, the Northward Center, Adler Aphasia Center, the law firm of Gibbons PC, Wells Fargo, Verizon, and by ADP. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.